Let's discuss the sinew and Luo-Connecting vessel system of the Triple Burner Channel. The Triple Burner Sinew Channel begins on the ring finger at the ulnar corner of the nail at TB-1, travels between the fourth and fifth metacarpal bones to the wrist, binds at TB-4, continues along the posterior aspect of the forearm between the small intestine and large intestine sinew channels, binds at the olecranon, ascends the posterior aspect of the upper arm to bind at the posterior corner of the acromion, traverses the posterior aspect of the shoulder and the lateral aspect of the occiput, and there meets the small intestine sinew channel. It then reaches the mandibular angle where it divides into two branches. One branch enters internally and penetrates the root of the tongue. The other branch ascends in front of the ear, binds at the outer canthus of the eye, crosses the temple, and terminates at GB13 in the frontoparietal region. There, it also meets the other hand Yang sinew channels. Clinical importance. We note some pathology. Some pathology is observed when there is stiffness, swellings, and distending sensations along the course of the sinew channel, curling or contraction of the tongue. Indication predominantly for pain, stiffness, spasms, tension, and distending sensations along the course of the channel, including the lateral aspects of the head and the body, as well as the lateral sections of the extremities. TB points can also be used for muscle tension caused by emotional disorders. Owing to the connection of the sinew channel with the tongue, some TB points are also indicated for motor disorders of the tongue. Now let's discuss the pathway for the triple burner Luo-Connecting vessel system. The triple burner Luo-Connecting vessel system separates from the triple burner primary channel at its associated Luo-Connecting point TB5. It forms a three-dimensional reticulate network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal divisions run to the interiorly-exteriorly paired pericardium primary channel. They travel as a transverse triple burner Luo-Connecting vessel to the Yuan source point P7. A longitudinal division follows the posterior aspect of the arm, crosses the posterior shoulder region, continues to the front of the body, and reaches stomach 12 in the supraclavicular fossa, penetrates the thorax, and reaches the pericardium primary channel, both dispersing in the upper, middle, and lower burners. Clinical importance. Excess conditions will manifest as tension of the elbow joint. Deficiency conditions, there will be muscle weakness in the arm, difficulty flexing the elbow. These channel connections and the status of the sanjiao as belonging to fire determine many of the actions and indications of the sanjiao channel points, which may be summarized as follows. Reducing fever. The sanjiao channel belongs to fire, and many of its points are indicated for febrile diseases, especially when due to exterior pathogenic factors. As far as differentiation of fevers, according to the 4 levels, is concerned, the sanjiao channel primarily treats fevers at the defensive and qi levels, whilst the pericardium channel mainly treats fevers at the nutritive and blood levels. All of the most distal points of the sanjiao channel, where the pericardium and sanjiao channels converge, are able to treat both. As far as differentiation of fevers, according to the sanjiao theory is concerned, points of the sanjiao channel mainly treat febrile diseases affecting the upper jaw lung pattern, although its most distal points also treat the upper jaw pericardium pattern. As for differentiation of fever, according to the 6 channels, both the spiritual pivot and the essential question state. Ta-Yang is the opening, Yang-Ming is the closing, and Shao-Yang is the pivot. The Sanjiao belongs to Shao-Yang, the pivot between the exterior and interior, and several points of the channel are indicated for alternating chills and fever and malaria, the characteristic indications of Shao-Yang pattern. The heat-clearing action of the sanjiao channel points extends to clearing heat from all regions traversed by the channel. benefiting the ears. Various portions of the Sanjiao channel encircle or enter the ear, and many of its points are indicated for disorders of the ear, such as tinnitus and deafness, especially when due to heat, uprising of yang, or other excess pathogenic factors. Clearing heat from the eye, especially wind heat and liver gallbladder heat. Clearing heat from the neck, throat, and tongue, soothing the heart and calming the spirit. Due to the close relationship between the Sanjiao and pericardium channels, many points of the Sanjiao channel are indicated for pain of the chest and heart, as well as agitation, restlessness, mania, epilepsy, and other manifestations of disordered spirit. Treating headaches. Shaoyang channel traverses the temples and side of the head, and points of the Sanjiao channel are much used in the treatment of headaches affecting this region. Harmonizing the three jiao. Sanjiao 5 and Sanjiao 6 especially are able to regulate the middle and lower jiao in the treatment of vomiting and constipation.